Ajay is a very good friend of mine, so and a great supporter, a great friend. So unfortunately, I have to make my case against him. So the question asked to me is why I prefer Razumab, and I do have financial disclosure. These are all my financial disclosures here. So why I prefer Razumab? Because I keep the facts separate from the opinion. I don't care about the opinion. I care about the facts. So if any drug which I would like to prefer, first and foremost thing is safety, as everybody said. It has been said since last few years. Now just look at the safety data, just see the facts of the data right from the beginning. Marina study was just now quoted, that Marina was a trial. Just look at the numbers of the inflammation in Marina trial. Endophthalmitis was 1%, serious uveitis was 1.3%, total 2.3%. And then just look at the numbers in the focus study, again in 2006. Numbers were 11.4, the cursor is not, 11.4 and 1.9 and 4.8. When the Razumab was launched, everybody must have seen this news, WhatsApp, any other media, multiple medias. Just look at the data and the fact. What was the number of cases? 11 cases out of 14,265 cases. So essentially incidence rate was 0.07%. Then what happened was, because every drug company, every new molecule goes through this phase. And if you just look at the data real carefully from 2006 to 2013 in cases of Lucentis, you will find the inflammation rate going up, down, up, down. And by 2013 onwards, if you see all the papers, they could achieve the inflammation rate down up to 0.420%. So just look at the number of years, 2006 to 2013. It took 7 years for Genentech to bring down the inflammation rate 0. And now if you look at the Razumab data from February 2019, nobody has heard any case. So it has achieved 0% of inflammation rate in just 3 years. So right from the beginning, when the drug was launched up to today, if I've been giving this presentation in 2016, I would have been on the other side, for sure. But not today. Now, second point for any drug, if I prefer, comes to the efficacy. Very well dealt with my colleague, Jacob. But if you look at the potency, this paper doesn't come from Razumab. This paper doesn't come from Intas. This paper comes from the Novartis head office, Basel, Switzerland. Just look at the findings of this paper. There's 100% potency when they compared the initial batches, when the reaction was there in 11 cases. So, and this is our data. You know why this paper we published recently? Because biosimilar experience is not there globally in terms of ophthalmology. But biosimilar experience is there in oncology. Oncology, what happens, there's a lot of studies in terms of the immunogenicity when you shift from one monoclonal antibody to another monoclonal antibody. So we were just trying to, just to test, whether that happens in ophthalmology. That didn't happen. We shifted almost 36 cases from ranibizumab, all because of the financial reasons, to Razumab. Efficacy was maintained, there was no immunological issue. Then the most important part comes to the financial efficacy, and I sometimes call about financial toxicity. We have seen, we have raised hands on how long we treated these patients. We have treated 9 years, 10 years. Is there an end of the disease? No. And all of us have seen the real world visual gains are poor. Then compared to the trial, why is that? We undertreat. Why we do undertreat? Finance. Even as a medical professional, being a doctor, if my father gets an AMD, and if touch wood, or DME, if I need to treat him for 4 to 5, it's a burden to me. So under treatment is there, and if you just compare these two drugs, I can save approximately 6,000 rupees an injection at the end of the 1 year. If I can give my father 3 or 4 more injections, then I am probably better off. And now even after proving efficacy, safety, even still, if somebody thinks that this is an Indian product, then probably that requires an introspection, severe introspection. Now what happened, this is another article that we recently published. there is a phenomena called nocebo. Nocebo is negative perception about something which is usually doesn't exist. And this doesn't happen now only in India. US FDA is fighting for this. FDA has recently launched a drive to actually educate people. And at the end, we should be rather proud that some product which is not easy to make came from this country and achieved a 0% inflammation rate in the last just 3 years. And you cannot take your face off. These are all our papers which I am quoting here. You cannot take our face off because these molecules are going to come on your plate. So you need to really see the data and facts before you get an opinion. Thank you very much.